Join us today on 50 Shades of Pain, where we're talking about
hips
and the top 2 reasons people have continued hip pain, and it's not arthritis. Welcome to 50 Shades of Pain. I'm Dr. Donish, the Medical Director of Wellward Regenerative Medicine, and I'm here with my co-host,
Dr. Escaloni.
And this is our 50 Shades of Pain show, where we're empowering patients with more knowledge to get ahead of their pain problems, where it's not just this reactive healthcare model of treating problems when they occur, but rather demystifying pain and getting ahead of them so that they don't keep recurring. And today we're talking about hips.
Yes.
Now, most people, they think about chronic hip pain, and you think, what?
Oh, I've got arthritis, I need a hip replacement, and that's it.
And there are so many other reasons people have continued hip pain. James, we were talking about this the other day, namely because person numero uno had some hip issues.
Oh yeah.
And we were talking about how untreated this would end up becoming osteoarthritis, but that when we can get ahead of the problem, we can actually do things to prevent the evolution of osteoarthritis. So, top 2 things that cause hip pain and people are undiagnosed or go undertreated for them.
Okay, so not arthritis of the hip. These are the 2 big things that we see all the time here, and people just don't recognize it outside of our practice for some reason. And it's 1, chronic tears of your gluteal muscles. For some reason that's ignored. All right, so Dr. Danish, tell me a little bit about that.
So we've got 3 different gluteal muscles that are relevant, and then one that's not called a gluteal muscle but is relevant because it's in the same area. Your 3 are the gluteus maximus, the gluteus medius, and the gluteus minimus. Now those are the top 3, but then there's another one called the tensor fasciae latae, and it goes right in front of and sandwiches the gluteus medius and minimus, whereas the gluteus maximus comes in from behind and comes down to the hip.
From behind is the glute max. Get it? It's the glute max that's in the behind.
Don't go there.
I don't know where he's thinking. It's the behind muscle. You sit on it. There you go.
So,
dad jokes here.
So these 4 muscles are kind of like the rotator cuff of the hip. Everybody talks about rotator cuffs in the shoulder. Rotator cuff being a group of muscles that hold the shoulder in place so that the capsule and the labrum, the structures that make the pocket for that shoulder joint, they don't have to work as hard to keep the shoulder in place. Those muscles and tendons do it. Well, the same thing is happening in the hip, where a combination of those 4 muscles and your IT band, which is that thick rubber band that runs down the side of your leg, those elements are essentially the rotator cuff of the hip and hold things in place. Now, just as how we develop rotator cuffs, in fact, there's a study that suggested your age is about the equivalence of the probability of having a rotator cuff tear. So like if you're 50, you've got a 50% probability of having a tear in your rotator cuff. I think that there's a similar correlation with hip pain, that there's a high percentage of people who have tendon injuries to one of those 4 muscles, or and tendons are kind of the extension of muscles. It's muscles become tendons that then go attached to bone. So tendinitis is really injury to the muscle and the tendon that attaches the muscle to the bone. And chronic hip pain, I see more often than anything else, is really chronic tendinitis, or tendinosis is really the term for it.
So here's the question that people are kind of curious about it. So this gets torn, and if this gets torn, well, I know I have to have a rotator cuff repair. So that means I have to have a gluteal tendon repair when this hurts?
No, in fact, there aren't the equivalent rotator cuff surgical repairs, but there are some non-surgical treatments for tendons that have injuries. Similarly, there are non-surgical treatments for rotator cuff injuries as well that can work very, very effectively for most rotator cuff injuries.
Okay. I like to keep you guys in suspense. We're not going to tell you yet. But here's the second thing that we're going to talk about.
Wait, hold on.
Did I miss something?
Yeah, because most people will think about arthritis when they talk about hip pain. So how can you tell the difference between a tendinosis and an arthritis?
X-rays?
No.
Oh.
X-rays can show you arthritis, but they can't show you the tendon issues. And in fact, arthritis is a very late stage problem. If you're developing X-ray findings for arthritis, we've missed the boat for a very long time. In fact, there have been other changes that would have been picked up with ultrasound, with physical examination, with a variety of other techniques before you ever see the evolution of arthritis. Arthritis is really the end product of untreated tendinosis.
Oh, okay. That makes a little bit more sense.
Now, for the patient, if you've got pain that's kind of through and through your groin, decent chance right here there's a decent chance that it's more arthritic or labrum or something to do with the joint and the joint capsule, versus if it's more pain on this outside part then, or this backside, then good chances that you're talking about a tendinosis. But either way, those are things that we can take a look at and give a more definitive diagnosis just by doing an ultrasound or examination to pinpoint the root cause.
So we have to send patients out for an ultrasound at some distant place?
No, we do them here, and the ultrasounds will help us visualize the underlying problem in real time, so we can actually find, okay, so it's hurting right here, and when I put the ultrasound right there, I can actually see the damage that's taken place there. We can even take it a step further by doing a quick injection there and making sure that that's where the problem is originating.
That sounds like a much better option than taking a picture of all of my hip and pelvis and guessing where the pain could be coming from and then saying, let's do a surgery and see what happens.
Yeah, or looking at the x-ray and identifying problems, but not really teasing apart if this is an active problem that's hurting you right now, or if it's an old problem that has since healed and has just left a scar in your bone.
Okay.
That's essentially arthritis,
all right.
The scars.
So I think these people are ready for part 2.
What's the second most common cause of chronic hip pain that is not osteoarthritis?
The sacroiliac joint, your pelvis being a little too bendy and flexible, and this guy right here is just trying to make up for it. Says, hey, stop being so bendy and flexible, tighten up.
Yeah, so the pelvis is actually kind of like a bowl, and then your spine sits inside of that bone. The joint between that triangular joint between the spine and that ring, which is your pelvis, is called the sacroiliac joint. It's essentially this area right here. Can you see me? This area right here. And a lot of people will mistake this for low back pain or sciatica even, because the pain from sacroiliac dysfunction will radiate down the back of your leg, similar to what typical impressions of sciatica do. But not everything that radiates is sciatica. Sciatica is a very distinct condition that's related to a pinched nerve, and that's very uncommon actually. Mm-hmm. Surprisingly, some of these issues like sacroiliac pain or ligament issues or gluteal muscle issues, like you've heard piriformis syndrome? Mm-hmm. So it's a muscle that can compress the sciatic nerve and mimic sciatica, but it's not sciatica. So figuring that out is just the first step in getting better.
Yeah, and so if you guys are a well-word, here's what we would do. We'd figure out what's going on by talking to you, really listening to you, do a physical examination, looking at your strength, how the joints are moving, how your pain is, and then confirm it, which a lot of other places don't do. We confirm it with a diagnostic injection to confirm that this is where some of the pain's coming from, and seeing how are you doing afterwards. Then we can know with a lot more certainty we can treat you the right way.
Yeah, it's part of our HEAL methodology. The first step is hearing the messages your body's trying to convey with pain. And first and foremost is understanding where that pain is coming from. If you're hurting in this area, I can name half a dozen conditions that could be, and teasing those things apart is not, you can't do it on an x-ray or an MRI or any kind of imaging. It's really a combination of examination, ultrasound, diagnostic injections, history, all of those things combined to really get at the root cause of the problem.
Okay. Well, you guys, guess what? We just gave you 2 amazing bits of information for free. All right, but you're going to have to wait until next time for us to tell you what to do about this and how we can help you get out of pain.
All right. Thank you for joining us on our 50 Shades of Pain show, where again, our goal is to empower patients with knowledge so that you can take control of your pain. Please join us on a weekly basis. We're going to release new episodes. You can find it on Instagram, LinkedIn, Facebook, and even on our wellwordmed.com webpage. So lots of avenues to get in touch with us. By all means, if you have any questions, feel free to ask. I'm Dr. Danish.
And I'm Dr. Escaloni.